Hello, my name is Liz Keys. I'm an RN and would like to thank you all for coming today to learn about hand hygiene among hospital care workers in a healthcare setting. This is an important topic because according to A. Collins in Preventing Healthcare Acquired Infections, Patient Safety and Quality, 2 million patients a year are affected by hospital-acquired infections. This results in 90,000 deaths and an estimated of $6 billion a year in additional patient costs. A hospital-acquired infection is an infection whose development favours a hospital environment, or an infection acquired by a patient during a hospital stay, or one that develops among the staff. There are three main points I would like to discuss about hand hygiene. First, hand hygiene is an essential practice in the daily routine of any healthcare worker. It's now evident that it plays a major part in the decrease of hospital-acquired infections. Secondly, clean hands prevent the spread of pathogens. In addition to clean hands, hand hygiene reduces the number of infections in healthcare settings. Hand hygiene is now a new word in healthcare vocabulary. It actually goes beyond simple hand washing and includes antiseptics such as alcohol-based formulations that are rubbed by the hands, and then clean, healthy hands with short fingernails. Thirdly, widespread implementation of hand hygiene products decrease infection rates, reduce costs, and improve time management for the healthcare worker. A hand rub formulation takes about 20 seconds, while soap and water hand washing takes about 60 seconds. The main champion in the Healthy Hands campaign is the World Health Organization. In May of this year, 2015, the World Health Organization, the CDC, and other partners focus not only on hand hygiene, but hand hygiene at the point of patient care. For example, as you can see from this poster, there are 5 main areas that are targeted between a patient, a healthcare worker, and the patient's surroundings. Number 1, clean hands are needed before even touching a patient. In fact, even before going into a room. Number 2, before any kind of clean or aseptic procedure such as cleaning a wound, dressing a wound, hands need to be cleaned. Number 3, any kind of body fluid exposure risk such as emptying a catheter bag, starting an IV, maintaining a blood transfusion, hands need to be cleaned. Number 4, after touching a patient, such as after a health assessment, hands should be cleaned. There should be no artificial nails, and nails should be kept short and clean. And finally, number 5, after touching a patient's surroundings and having completed the patient's care in the room, hands should be cleaned before leaving the room. So in closing, we can see how crucial hand washing is in the healthcare setting. Hand hygiene alone cannot eliminate all these infections, but certainly goes a long way to reduce the number of illnesses and deaths each year caused by hospital-acquired infections. There is no doubt clean hands prevent the spread of pathogens in a healthcare setting. And hand hygiene reduces the number of infections in a healthcare setting. Also, the implementation of hand hygiene products affects rates, reduces costs, and saves time for the healthcare worker. So, what does all this mean exactly? Well, the evidence suggests that hand hygiene has saved millions of lives in the past 10 years. 1% increase in hand hygiene compliance results in a saving of almost $40,000 a year in a 200-bedded hospital. That's just 1% hand compliance. There is no doubt that these practices can lead to an overall improvement in patient safety and a decreased cost across the entire healthcare organisation. Thank you for listening. Does anyone have any questions?
Why wouldn't healthcare workers wash their hands?
That is a great question. Well, according to the World Health Organization, there's several potential and actual barriers to hand washing by healthcare workers. First of all, the cost of setting up a program like that can be very expensive initially, and it can take some convincing of managers that the cost is worth it in the long run. There are staff shortages, and sometimes the priority of care precedes priority over hand hygiene. There's a lack of staff commitment, unfortunately, sometimes. Their present culture doesn't always encourage education, and there's still a perception that hand washing isn't really a problem. Long shifts can cause forgetfulness, and hands are actually washed less towards the end of a long shift. And there's other barriers like skin allergies or skin irritations.
How was cross-contamination and cross-infection first discovered?
In 1847, there was actually a Hungarian obstetrician named Dr. Semmelweis. He ran 2 clinics, one by midwives and one by medical students. The midwives' clinic had a lower mortality rate than the medical students. During a wound autopsy, Dr. Semmelweis noticed that there were similarities between the autopsy case and the postpartum fever. It was then that he realised that if medical students washed their hands before attending labouring mothers, that perhaps the infection rate would go down. Midwives did not do autopsies. As a result of this discovery, fatal postpartum fevers decreased in the medical students' clinic. Any more questions? Okay, well, thank you again for coming.